I call this meeting to order. Welcome to meeting number 86 of the House of Commons Standing Committee on Health. Today's meeting is taking place in a hybrid format pursuant to the standing orders. In accordance with our routine motion, I'm informing the committee that all remote participants have completed the required connection tests in advance of the meeting. Pursuant to Standing Order 108 Sub 2 and the motion adopted on September 20th, 2023, the committee is holding a briefing with the Minister of Health and the Minister of Mental Health and Addictions about their mandate letters. Before we begin, I would like to welcome the Honourable Mark Holland, Minister of Health, as well as a very esteemed group of officials accompanying him this evening. From the Canadian Food Inspection Agency, Diane Allen, Associate Vice President, Policy and Programs, by video conference. From the Canadian Institutes of Health Research, Dr. Tammy Clifford, Acting President, by video conference. From the Department of Health, Dr. Stephen Lucas, Deputy Minister, Lynn René de Coutray, Assistant Deputy Minister, Oral Health Branch, Jocelyn Voisin, Assistant Deputy Minister, Strategic Policy Branch, and Dr. Supriya Sharma, Chief Medical Advisor. From the Public Health Agency of Canada, Heather Jeffrey, President, and Dr. Teresa Tam, Chief Public Health Officer of Canada. I believe all of the officials would be well aware of this, Minister, but perhaps you are not. The convention that we have, or the practice that we follow on this committee, that seems to be most relevant when ministers appear, is that we try to keep the length of the question the same as the length of the answer. So if you're inclined to go on longer than the length of the question, you can probably expect to be interrupted. If you're interrupted prematurely after a long preamble, I'll step in to make sure that you get a chance to finish your answer. And I would encourage I would encourage people to use the translation earpieces that are available for that purpose. And with that, welcome to the committee, Minister Holland. You have the floor.
Merci beaucoup, Monsieur le Président. C'est un grand plaisir.
Thank you, Mr. Chair and honorable members. It's an honor to appear before you today for the first time, my first time here in my new role as a Minister of Health. And I'm very pleased to speak on important issues for our country.
With officials that you've recognized, Mr. Chair, to take your questions, which I very much look forward to. So appreciate the opportunity to be before committee. I thought I would take a moment, if I could, just to talk about where we are right now. You folks know that we made an incredibly significant investment, a historic investment in health, $200 billion thereabouts over the next 10 years. And you would have seen the first bilateral agreement in BC, which was a phenomenal opportunity to talk about how we're going to begin to move forward in collaboration with the provinces on transforming our health system. That doesn't just mean fixing the workforce issues that are there today, but it means taking important action on the deeper transformation that needs to occur in the future. And so you can look at the bilateral agreement that's there in BC and what it does, but I would also point to the health ministers meeting that we had in Charlottetown, something, Mr. Chair, that a place that you know a little bit about. And in Charlottetown, we had the opportunity with health ministers to talk about our shared priorities. And I think that the way forward in health is collaboration. And I was deeply encouraged by the conversation that I was able to have with my counterparts of all political stripes, who set aside partisanship and ask how we can put the best interests of our health system first. And I'm sure that the spirit of that will emanate in all of your questions today. So one of the things that folks may have missed that I think was critically important in that meeting was a 90-day service standard for regulatory bodies to provide certification and licensure to internationally educated health professionals. There was also commitment to a health data charter to make sure that provinces and territories can share health data. We know that health data saves lives. I'd love to talk more about that in your questions. A commitment on national licensure so that that nurses and doctors can practice anywhere across the country. We also took action on a nurse retention toolkit, recognizing that keeping the folks that we have is just as important as hiring new folks. And we made a commitment around Center of Excellence, because we know within our health system we get times of boom and bust in terms of our workforce, so making sure that we plan so that in the future we don't have these periods of time where we're in need or where we have too many people. And, of course, we're getting ready to move forward with a dental program for all Canadians that I'm extremely excited to talk, I'm sure, more about here at committee. Already, more than 370,000 children who have never, in many instances, have never had oral health before, have been able to be helped by this program. When it eventually rolls out, we're talking about 9 million Canadians, 3.5 million seniors, more than 100 disabled folks who don't have access to dental care who will. To talk about how significant that is, Mr. Chair, if I could just for a second, when we're talking about children, imagine that the number two surgery for kids is oral health. The number 2 cause of needing surgery, and that is preventable, that we could eliminate that. Imagine what that means for those families and what it means in terms of cost prevention, and then extrapolate that against the whole system. It's not just a matter of justice and making sure that everybody has a great smile. It's also a matter of prevention and good health. I would say that we've taken really important action on pharmacare. Already the action that we've taken with provinces and territories on bulk purchasing have realized a savings of $3.5 billion for consumers. We would have the first ever strategy for rare diseases, where we're putting $1.5 billion to work with provinces and territories to take action there. We're moving forward with action on a Canadian Drug Agency. I can talk in your home province, Mr. Chair, about the PEI pharmacare program and the hundreds of thousands of dollars that have been saved for residents of Prince Edward Island. The point, Mr. Speaker, and we're getting ready for your questions, so I'll wrap up my comments, is that together enormously positive and exciting things are possible within our health system. They're possible because we cooperate and work together, set aside partisanship, and really focus on getting the work done on behalf of Canadians, to go from having one of the best health systems in the world to having the best health system in the world, and that's our collective mission. With that, Mr. Chair, I'm ready to take your questions.
Thank you, Minister. We're going to start off with the Conservatives for 6 minutes. Dr. Ellis, please.
Thank you very much, Chair, and thank you, Minister, for being here. First off, just a few simple questions. In the past 8 years, can you tell me what's happened to housing prices in Canada?
What I can say is that Canada remains one of the most attractive places in the world to live. And being one of the most attractive places in the world to live, we're welcoming some of the most skilled and incredible people anywhere in the world.
Well, thanks very much,
and as
Minister,
a result of that,
was related to what has happened to the price of housing in Canada in the last 8 years.
Sure. So what I'm saying is that Canada certainly is facing challenges around affordability and in terms of housing.
Chair, that was not my question. My question was very specifically related to what is happening to housing prices.
Well,
I've already wasted 45 minutes at a 2-second answer.
I'm not sure if you want an answer or if you want to make a political point. If you want to make a political point, I'll leave the floor to you. No, go ahead and make your point. Make your point, and then I can answer a question.
Chair,
but you
are we
don't appear
play this
interested
game
in
all
an
evening,
answer.
or we're going to have some answers to questions here? What's happening to housing prices in the last 8 years? Simple question.
They've gone up.
Yeah, how much?
They've gone up considerably.
How much?
Depends on the region, depends on the place.
How much on average in Canada?
The housing prices have gone up.
Yeah, good answer. Doubled. Mortgage costs? Same question. How much?
Mortgage prices have gone up.
How much?
They've gone up significantly.
You don't know?
I'm not saying I don't know. I'm saying that. Look, am I allowed to answer, Mr. Chair? I don't know if the point is to badger the witness, then I don't know. You're succeeding. If your point is to badger me and attack me and not give an opportunity to provide context, then you're succeeding.
That's it.
Mr. Chair,
then if I get the opportunity, Mr. Chair, to answer.
I've got a couple of points of order, one from Ms. Sidhu and one from Mr. Fisher.
I'm sure Ms. Sidhu's is the same point of order.
Yep. Go ahead, Ms. Sidhu.
Just want to, we all want to listen Minister's answer. So if my colleague will let Minister, give the answer, please. Thank you.
Thanks very much, Chair.
Mr. Speaker, Mr. Chair, I still had a point of order, sorry.
Go ahead, Mr. Fisher.
He's the Minister of Health, and we're very fortunate to have him here today. He's not the Minister of Housing. So, Mr. Chair, if you could just push relevance a little bit, that would be great. Thank you.
Okay, so I'm
Mr. Chair, if the point is to create like a soundbite, like I think he's got it.
Yeah.
If he's interested in an answer, if I could be afforded 60 seconds to provide an answer, is that a reasonable request?
Not unless you get a 60-second question.
Okay, well, then we'll
okay.
continue
So
this if
I'm going to
that- if
rule
he
on
finds
the
it
2
useful.
points of order. So there's 2 points of order here. One is that you're being incessantly interrupted without being afforded the chance to answer, and the other is that you're being asked questions that would very clearly not be in your mandate letter. With regards to the first one. I would say that Dr. Ellis may not like your answers, but you are giving an answer, and it's if he doesn't like the answers, then that's fine. I can't compel you to give a different answer, nor will I, nor should I, nor could I. With respect to questions outside your mandate letter, I think that's entirely fair, and I would encourage Dr. Ellis to bring it back around to something that would be within your mandate letter. You didn't lose any time with those points of order, Dr. Ellis, and you have the floor again.
Thank you very much, Chair. Certainly, I would believe that housing would be an important part to people's overall health. How much has the average rental apartment increased in cost in the last 8 years?
One of the things that I will say about political discourse in this country is that not having a real discussion about the issues that are in front of us do them an incredible injustice. Asking for one-word answers presumes that the problems and the complexity that's in front of us
Mr.
deserve
Minister, I
those
appreciate
one-word
that.
answers. If
Chair,
there's an interest in a
go ahead,
dialogue,
Doug.
I understand
How many new
personally.
houses need to be
Minister.
built by 2030 to satisfy the demand in this country?
Personally, I believe the purpose of discourse is to understand one another and to listen to one another. In the questions that you're asking me and the staccato nature of them, it's clear that you have a partisan interest. There's an opportunity on Twitter or Reddit or wherever you make these points.
Thank you very
to
much,
do
Minister. I
that.
appreciate that. The average inflation on the cost of food in September of this year?
These are the questions you ask every day in question period. I am the health minister. I've agreed to come and talk about health. You have not only asked a single question of health
Thank you,
here,
very
you
much,
haven't asked a
Minister. I
question of health in the
appreciate
House of Commons. Can I ask you why you
me
refuse to
this
ask any
about,
questions as the health
excuse
critic
me,
in the
Chair.
House of Commons?
Minister, Dr. Ellis, go ahead. You have the floor.
Thank you very much, Chair. Drug approvals. How much longer does it take to get a drug approved in Canada versus the United States? How many days?
In Canada, I'm deeply proud of our drug approval process, which makes sure that Canadians remain safe and that the considerations are based not only on efficacy,
Thank you very
but
much,
also
Chair. I don't
safety.
think I asked you anything about safety. I asked you how many more days does it take to get a drug approved in Canada? That's well within your purview.
It is, sir, and I would say that safety goes along with speed, and that we can't
Safety
just
is
think
not
about
days, sir.
marketization
much.
of a drug. We also
Chair,
have to
how
think
many
of
more days
safety,
would
and
it
that I
take
am
to get
very
a drug
proud of
approved in Canada
the
versus
department's
the
work
EU?
to make sure that the drugs that go to Canadians are safe.
Okay, we have a point of order from Mr. Theriault.
J'ai pas de traduction. Ça va
Oui.
vite un peu, peut-être aussi pour les gens dans la cabine,
Oui.
mais j'avais pas de traduction.
Oui, je mets
I didn't have the interpretation. I know the speed is extremely fast. I think it's hard for the interpreters when there's two people speaking at once. They do a wonderful job, but the sound cut off, and I would really like to be able to follow the nature of the debate, but
I know it's difficult, Minister, because the questions are so short, but this is actually the way we do it here, and
It doesn't represent discourse, but if that's what's the wish of the questioner, then I'm happy to abide by that, Mr. Chair.
So, okay, we're back to, hopefully, are we getting translation now? Est-ce que la traduction fonctionne maintenant?
is the translation working now? Okay.
Thank you
Dr.
very
Ellis.
much, Chair. How much longer does it take to get a drug approved in Canada versus the EU?
I would ask. You haven't met with me. I've tried to meet with you. You haven't asked a question in question period.
Excuse me, Chair. That's absolutely not the question here. Absolutely unacceptable answers. What's the leading cause of death of 10 to 18-year-olds in British Columbia?
I don't think you have any interest in my answers. I think you're here to make a
So
political
now you're not
point.
going to answer? Is that what we're going to get? No
These are-
answers?
they're-
Do you know what the leading cause of death of 10 to 18-year-olds is in BC?
I find the way in which you're posing your questions and the aggression to be.
The point is, do you know the answer to the question?
What is your point? Get to your like. What is your question?
No,
What are you trying to
you're
get
not
at?
here to ask me questions. I'm here to ask you questions. I'll say it slower. What is the leading cause of death for 10 to 18-year-olds in British Columbia?
Mr. Chair, point of order.
Yes, Mr.
We're used to that member not showing respect to members of this committee. I would ask that he shows some respect to the minister. That was not called for.
And it isn't a point of order. As valid as it may be as a comment. Go ahead, Dr. Ellis.
I think I've already asked a question, Chair, for which I expect an answer.
I can say that province by province, I can't tell you what the leading cause of death is, but I can tell you.
Thank you very
that
much, Mr. Minister. I'll help you with that. It's drug overdose. Drug overdose. Chair, through you, how many people die on an average Canadian day every day due to drug overdose?
I don't have that figure on me.
You have no idea?
How many people die on
Point of order,
average in a
Mr. Chair.
day? Entirely too many.
Point of order.
And I would say that what we have to do is
Excuse me,
work
Minister.
together
Point of
collaboratively
order.
to be able to. I would say, if I could, is it fair to say
Mr. if I could
Excuse
just-
me,
that we
we have
need
a point
that
of
we need to
order
work
which takes
collaboratively in a
precedence.
nonpartisan
order.
way to deal with issues as extreme as
Chair,
being
Minister,
addicted
this is a
to
point of
opioids?
order,
Minister.
Chair. This is a point of order.
Minister, go ahead, Mr. Davies.
Well, it is wide latitude for questions, but we have the Minister of Health for the first hour. We have the Minister for Addictions and Mental Health in the second hour. And Dr. Ellis is asking a question about clearly under drug policy and opioid deaths, which I think would be more appropriately put to the Minister responsible for mental health and addictions as we have scheduled.
Mr. Chair, my understanding is 21, but if I could just say, as an appeal to decency, that if we're dealing with people dying of opioids, that having a conversation rather than would be valuable. If they're, I've given no
Minister.
opportunity to be able to elaborate on any point.
I think you will when the next person starts asking questions. You have barely 7 seconds left, Dr. Ellis.
What's the average wait time for mental health treatment in Canada, Mr. Minister, to see a psychiatrist for children 18 years in age or under?
The Minister Sachs, the Minister responsible for mental health and addictions, will be here in about an hour.
Thank you,
Thank
for
you,
that,
Dr.
Chair.
Ellis.
Absolutely useless.
Next, Dr. Poloski, please, for 6 minutes.
Well, let me say, as a doctor who's worked 35 years, I can't answer those questions precisely either. Now, let me ask you a question about something you already brought up. And I'm the guy that's got the floor.
But
guy.
he does have the floor,
Sorry.
please.
An issue which I think we did pretty well addressing in a pretty nonpartisan fashion in an earlier study this year was the health workforce shortage of doctors and nurses. And I think a pretty strong recommendation coming out of not just that study, but at least one other study was making it easier for foreign health graduates, doctors, nurses, other allied health professionals to get licensed in Canada. From what you said, out of the Charlottetown Agreement, there is some progress, for example, on national licensure, which yet again was something we heard over and over again was something that was in our best interest. And also making it easier in other ways for foreign-trained health professionals to get licensed here in Canada. Where do we go from here to get to that end? And certainly in my riding, we've got places like Atikokan, Emo, Rainy River that have been short of doctors, a lot of places short of nurses for a while. What are the next steps, and when do you foresee there will actually be more health practitioners out there? And you're welcome to either answer yourself or to ask one of your staff to answer it.
Well, thank you, Mr. Chair. And through you, let me just take an opportunity, because I thank you for the question, and I just take an opportunity to say to members of Health Committee that there are incredibly difficult and complex issues facing this country. How we engage each other, the way in which we have conversations matter. And, you know, any good conversation involves the attempt to understand one another and one another's perspective. I don't believe that there's anybody in this committee who wants another opioid death. I don't believe there's anybody who's on this committee who wants to see anybody suffer in this country at all, in any way. It is the objective of our health system to try to tackle the complex issues that are in front of us. I would suggest that in health, more than any other space, that the need to put aside partisanship and have level conversations is important. And I appreciate the opportunity to be able to say that. Now, with respect to health workforce issues, we have to approach this from a myriad of different directions. The first is to go back to that point around collaboration. The meeting that we had in Charlottetown, I think, was incredibly significant in that we were able to set aside our differences, our partisanship, and talk about solutions. And I think the commitment that was made around, as I talked about retention, about that 90-day service standard, around national licensure, those are really huge items to move the needle. We also talked about how we can accelerate recognition of foreign credentials, how we can continue, while respecting our WHO guidelines, to be able to immigrate folks faster and be able to have more folks here to deal with this. And I look at a place like the Nova Scotia College of Nurses, which is doing phenomenal work to streamline their approval processes, and is doing phenomenal things to meet the challenges they're facing there. So I think through collaboration and working together, that we can not only get through this crisis, but with the Center of Excellence, manage it so that we don't wind up in a position of crisis again.
Can you give any timeline before we actually see people appear on the front lines?
Well, I think you're seeing it now. The bilateral agreement that was signed with British Columbia is a tangible example of addressing workforce issues, and British Columbia laying out their plan and us being part of it. The other bilateral plans are doing that. You're seeing us work with the provinces on the items that I stated. So you're seeing action now, and you're going to be seeing steady improvements over the coming days and months.
Second thing I wanted to ask you about was WHO's new treaty on pandemic preparedness, which is being negotiated, and the first draft is out. I found the first draft very exciting, with a number of provisions which I thought were very progressive. One of those being a requirement that countries contribute annually to the fund to assist poor countries meet their obligations under the treaty. A second thing would be a benefit sharing provision, whereby any products that were made from the genetic sequencing of any new virus would be shared between countries. Any products, 10% of those products would go free of charge to WHO, with an option for a further 10% to be sold at affordable prices to WHO. This is, I know, only the first draft. I know this is just kind of coming back to us. But would our country be supportive of trying to get such provisions, which I think many of us at this table feel are in our national best interest, because we know that much of the threat in terms of pandemics will come from poor countries who don't have the facilities to early on detect and respond to diseases. These provisions would help poor countries do that. I think it's in our best interest. Is Canada willing to try to support that in the further negotiations, with a view to perhaps having such provisions in the final version of the treaty? And again, I know Dr. Tam, I think, has an interest in international health too, and we have at least one other pediatrician. So maybe we could start with you, Minister, and then we could ask, if there's time, some of the others.
Thank you very much for the question.
Dr. Pelosi hasn't left you much time. Take 30 seconds, and we're not going to be able to run that around the table unless it's on a future round.
Just very quickly, I can say that I met today with the U.S. ambassador, and we were talking about how we can work together to strengthen our two countries can work to support internationally preparedness, and it's so important that we work with our international partners to make sure that we're as prepared as we can be, not only in Canada, and I mentioned just today in question period going out to the facility in Laval that's being built with Moderna so we can make domestic capacity, but as you say, to help other countries to make sure that they're also ready, not only to stop the death and the pain that would come from lack of preparedness in those countries, but because we also know that keeps us safe. So the international work that we need to do is critical.
Thank you, Minister. Monsieur Thériault, pour 6 minutes, s'il vous plaît.
Thank you, Mr. Chair, and welcome, Mr. Minister. It's the first time we've had the opportunity to speak. How would you qualify your relationship with Quebec? Good, bad, very good, excellent. Thank you very much for your question, and I think that I have a good relationship. Thank you. Thank you. That's okay. So, you spoke earlier. You said that to be above partisanship. The National Assembly probably heard you because you said on October 23rd you wanted to reach a bilateral agreement with Quebec. 1 week later, what you have as an answer is a unanimous motion from the National Assembly telling you to mind your own business. Can you explain how is this a good relationship? Well, it's not a question of jurisdiction. This is absolutely essential for Quebecers, yes, and also everyone throughout the company to see the progress in our healthcare system and in the data. That's essential. Yes, so you're reaffirming this, that negotiations with Quebec is not a question of jurisdiction, but of results. So I understand what you're trying to say. You want to measure a provincial performances in their field of jurisdiction. So if I say Ottawa and the Council of Federation, and Quebec is a part of, agreed, and the government of Quebec has priorities, improving access to a family doctor, support healthcare workers, reducing wait lists for surgeries, improving access to mental health and addiction services, improving access to digital data. Since Quebec is working on this, what's the issue, Mr. Minister? What are your extra conditions when Quebec is already doing all of this? There's no problem, but it's obvious that we have to check with each province and territory. We have to check the data. We have to check that the data is there in order to measure progress. And I think it's very good for the province of Quebec. And if it's possible to have the same indicators, the same data, then it's possible for people to see tangibly the progress in their healthcare system, and that is a very positive thing, in my opinion. That's the objective. Yes, but what's your field of jurisdiction to be able to set key indicators when you're not at all managing any staff? Are you sitting at the table of negotiations of the Front Commun? Do you know how a negotiation happens at the Front Commun? Do you know the impacts that this can have on the healthcare system? Well, I believe that the indicators and the data is something that happens, that is essential in the beginning. There are 8 that are available, and the things that are the most important in the beginning of a process. And it's clear that for people to have the ability to see results, I believe it's very important. And I'm wondering why this is an issue. You want these results over how many years, Mr. Minister? I let you speak. So over how many years do you want these results? Because do you know how many health reforms happened in Quebec since 1985? Do you have any idea? 6. We had 6, Mr. Minister. I know that you're not aware of this, but we've had 6 in 89, in 92, Jean Rochon, 94, Philippe Couillard, 2003, Gaétan Barrette, 2014, and now Christian Dubé. We're trying to do more with less. And then you say, in 2023, oh, we want results. Well, do you think that all these successive governments who were trying to do more with less didn't want results, Mr. Minister? So how can you identify these results? These results are over how many years? Next year? I mean, that's not, if you say you don't like the results, are we going to cut the health care transfers and we're not going to have an agreement? Well, it seems that you're trying to be disputatious, and I'm looking for solutions. No, I'm asking you a question. I speak with Quebec and provinces, and when I speak with Minister Dubé, the conversations are very constructive. And I can tell you, it's very possible to find a solution in the spirit of cooperation. The National Assembly unanimously just told you to mind your own business. They were unanimous on this, Mr. Minister, and that's not a very good relationship. Please allow the Minister to respond. Health is a priority for everyone, regardless of where they reside in the country. You have 2 minutes. Okay, so what I would say is that right now we have some patience because you haven't put anything on the table. You put $1 billion on the table at the end of a pandemic, but we needed 6 on a recurring basis. And now it's hard for people to make this network work to make sure that it's solid, that we're never in a situation of a pandemic where we have these quarantines, people at the CHSLDs, so that they won't be infecting older people, and we find ourselves in a huge mess of a situation. We need a lot of money, and it's not $1 billion for Quebec on a recurring basis that we're going to solve the issue. And this is over 10 years. Well, it's been 9 months, and nothing has been signed with Quebec. And unanimously, the Assemblée Nationale, the National Assembly, is saying, mind your own business. So I think there's a problem. What are your conditions? You haven't set them out. Well, we're prepared to cooperate with the province of Quebec, and certainly there are billions of dollars that are available for Quebec in order to improve their healthcare system. And so this is a good news story. This money is available, but there are other things that we need. We need cooperation, and we need also there are $131 billion that's available to Quebec. It's a huge amount of money. And our condition is to say we need data. We need data. We need to be able to measure progress, to make sure that there's progress within the system. In my opinion, it's very reasonable. Thank you.
Mr. Davies, please, for 6 minutes.
Thank you, Mr. Chair. Congratulations, Minister, on your appointment, and thank you to you and your staff for being here tonight. Minister, for-profit clinics across Canada are currently charging desperate patients tens of thousands of dollars for two-tier access to non-emergency surgery. The clinics are exploiting a loophole in the Canada Health Act that allows people to pay to jump the queue as long as their surgery is performed in a province where they don't reside. In the last election, the Liberal Party committed to strengthening the Canada Health Act to protect the integrity of our public health care system. Minister, will you act on that promise and act to close this cash for access loophole?
Well, thank you very much for the question. And I am concerned that coming out of the pandemic, our health system was weakened. We asked an enormous amount out of our healthcare workers, and coming out of it, there were a huge number of health issues that resulted in backlogs and challenges for provinces and territories. And certainly, one of the concerns that we talked about in Charlottetown is a concern about the growth in for-profit operations. You're absolutely right. We have an obligation under the Canada Health Act to protect the public nature of our system and to make sure that it stays public. I can say that the conversations in Charlottetown with all of the health ministers, that I was able to reiterate that and talk about a need to push out privatization that we see in the system.
I'm keeping really close track of the time, so I've got some important questions. My next question is, the federal government sounded the alarm in 2021 over a rapid increase in youth vaping in Canada. And they proposed to regulate the sale of desirable flavors, but 2 years later, Health Canada has shelved the proposal, apparently walking away from further regulating flavors, and they've left it up to the industry to regulate itself. Can you explain why the government is refusing to act while Big Tobacco uses vaping flavors like cotton candy, mango, and berry to hook a new generation of children on nicotine?
Well, let me just acknowledge the concern. When I was at Heart and Stroke, I was their executive director. I was one of the first out warning of the dangers of vaping and the need to have controls, and that basically the companies that are in the business of selling nicotine, which was really what this is about, were looking for another delivery mechanism, and seeing the increase in the youth population is deeply concerning to me, and the flavors you're talking is deeply concerning to me. So I want to validate the concern and want to say that it's something that we're actively looking at and working on, and that I will get back to you on.
Thank you. Minister, I want to congratulate your government for recently agreeing to launch an expedited review of Canada's breast screening guidelines through the Canadian Task Force on Preventive Health Care. Up to now, for several years, experts, patients, physicians, and researchers have called the current guidelines, quote, outdated and dangerous, end quote, and have called for the immediate intervention in the review process. They've noted that problems with the existing guidelines are, quote, driven by a strong anti-screening agenda of task force leadership and persistent use of 60-year-old studies. We note that today, recently, Ontario noted that women aged 40 to 49 who have mammograms are 44% less likely to die of breast cancer than those who don't. Minister, what steps, if any, is your government taking to address those concerns?
These are important questions. I'm going to turn to Heather Jeffrey, if I could.
Thank you very much, Mr. Chair, for the question. We believe the issue of breast cancer screening and the guidelines is really preeminent importance to Canadians. That's the reason why we put in place a knowledge exchange forum, which took place with scientific experts from across the screening continuum to bring their experience to the table, as well as those with lived experience with breast cancer. We've opened a portal to allow all researchers and Canadians in general to contribute the latest research. And the review panel of the task force is currently doing an expedited review of the guidelines, considering all of the evidence, including the latest real-time evidence.
Thank you.
And we'll return with the decision.
Many health practitioners, Minister, small business owners, and consumers from across Canada have expressed serious concerns to this committee that the government's proposed labeling requirements and new fees for natural health products will result in increased costs, serious harm to the sector's financial viability and jobs, and reduced choice for Canadians. They also complain of a lack of adequate consultation. Minister, will you consider a pause on the regulatory changes until the natural health product sector is fully consulted and on board with any systemic changes?
Well, let me say first within the natural health space that we are committed to keeping Canadians safe. And it is essential that Canadians know what is in the products that they buy. It is essential that false and misleading claims are not allowed to be pervasive. It's particularly concerning when so many products are making claims in the space of cancer and in the space of cardiovascular disease. And these are for very vulnerable people who are being misled that products are going to help them that aren't going to. And it's imperative that people not make profit off of people's pain. So it's imperative for us to take action in that space. And I want to quickly, if I can, Mr. Chair, just very quickly to talk about the attack on Dr. Sharma as the Chief Medical Officer of this country.
Point of order, Chair.
That if we are going to deal with information, that attacking officials is totally inappropriate. And,
point of order, Chair.
And
I think I have a point of order, Chair.
Go ahead, Dr. Ellis.
I guess I'm wondering, the great arbiter of our committee has never asked one question about pharmacare. He's deeply in their bed on pharmacare. I'm just wondering why he's not talking to the minister about pharmacare.
Well, maybe you'll get a chance to ask that when you get the floor, but it's not a point of order. Go ahead and finish your answer. Minister, there's 40 seconds left in this round of questioning.
Well, with respect, I want to get my last question in, and then maybe I can...
I guess you're done your answer.
My last question is, in 2021, former Health Minister Haidu told Canadians that a full investigation into Canada's COVID-19 response would be required at the appropriate time. In September 2022, former Health Minister Duclos noted that a decision on a federal COVID inquiry would come soon. We note that the government has failed to take any action since. In fact, when I recently moved an amendment at this committee to establish an independent public COVID-19 public inquiry under the Inquiries Act, Liberals voted against it and the Conservatives abstained, killing the inquiry. Can you explain to us, Mr. Minister, why a fully independent, comprehensive and penetrating inquiry into Canada's response to the most severe pandemic in the century isn't needed, or when it might be convened?
Well, let me start by saying
as briefly as possible, Minister. We're out of time.
I'm sorry?
As briefly as you can.
Oh, that's tough. I will say that we are utterly committed. There's already scores of studies that are going on reviewing Canada's pandemic response, which was among the best in the world, one of the lowest death rates in the world. We are committed to having a pandemic review. We're looking forward to talking about that, but it's essential that be forward-facing and constructive so that we can be ready to prepare to protect Canadians to the greatest extent of our ability.
Thank you, Minister. Dr. Kitchen, please, for 5 minutes.
Thank you, Mr. Chair. Minister, thank you for being here. Minister, your mandate letter states that the government, and quote, the governments must draw on lessons learned from the pandemic to further adapt and develop more agile ways to serve Canadians. So how is this supposed to happen when your government refuses to hold an actual national public inquiry?
Well, I think that as I mentioned, there are scores of reviews that are happening right now that we are talking with our international partners as well about their reviews and lessons learned. And I've just indicated that we will be looking at a pandemic review mechanism.
Thank you, Minister. I mean, ultimately, we are short on time. So the reality is, though, you were asked that question today in question period, and you basically didn't give a date at that time. Your colleagues have given responses similar to what you've said that we're going to do that over the last 3 years, yet we don't have an actual date. Can you give us an actual date today, please?
I can't give it to you at this time. Unfortunately, we continue to live through the pandemic.
Thank you for that. So if you
Mr.
can't
Chair,
give
I
us,
believe I have the same amount of time as that was given to ask
the question was a very short, can you give us a date? You can't give us a date, therefore the question was answered. My question to you then is, if you
if that was the purpose of your
can't,
question, you've achieved your goal.
question that I have is now is if you can't give us a date, can you tell us exactly when you think that date will be?
I think it will be in the near future. That if I can be given an opportunity to elaborate, or are you done with you got what you wanted?
I got what I wanted, which is the near future. Thank you. So, on that very issue, you were asked today by a question today in the House of Commons, and your answer to that was basically saying you're going to do a forward-facing review. Now, I'm an educated man. I've done many studies, many research studies, never done one that's actually called a forward-facing review. So can you tell us very quickly what a forward-facing review is, please?
Making sure that we are incorporating and metabolizing the lessons of the pandemic so that we can ensure that they prepare us for the future, so that the next time we're facing a pandemic, God forbid, that we are as prepared as possible as we continue to navigate the one that we're currently in.
Thank you. So ultimately, your mandate letter further states, and multiple times that states, that you are to review the lessons learned from the pandemic, which naturally requires you to reflect on your government's past mistakes. Is that going to be included in this review?
Absolutely, and I think that every country around the world, as it was dealing with this pandemic that nobody expected, realizes there are things we could have done better, and that part of this process is acknowledging that, learning from it, and making sure that we incorporate those lessons so that we're as prepared as possible in the future.
Thank you. Minister, can you tell me how much money the PHAC basically is forecasted to have spent in 2022-2023?
I'll turn to Heather.
Okay, no, I'm sorry. I'm asking the minister. So the minister, if you can't give that and avoiding having to get the response, I can give you the answer.
$4.8 billion.
So the answer is
$4.8 billion.
The amount is actually $12 billion in total.
That's we can compare. I'm not sure if your objective is to try to play some sort of gotcha game.
Sir, Minister,
it doesn't appear that you're interested in asking about the pandemic.
Minister,
this seems to be.
Minister, the question was how much. You can't give us. The reality is, I'm looking from Public Health Agency of Canada documents that clearly indicate the amount. So the amount you're giving is totally different. So let's stick with the one that we have here, and the reality is that $12 billion is the total that they would be projected to spend this 2022-2023. Now, next year, it'll be less. Ultimately, it'll be down to $3.379 billion, and that amount of money that'll be spent strictly on issues about disease prevention and control. And the reason for that is because the budgetary authorities have, for procurement of COVID-19 vaccines, have been stopped. And that's why the reduction of it. So can you tell me how many vaccines were purchased with that $2 billion plus?
Well, what I can tell you is that Canada's response and ability to procure vaccines was among the best.
Can you tell me the numbers?
You asked a 40-second question. The minister can take 40 seconds to answer it, not 4. Go ahead, Minister.
Canada's response to the pandemic ensured that every Canadian had the vaccines they needed. And it meant that Canadians got vaccinated, and that saved hundreds and hundreds of thousands of lives. The quantity of vaccines that were purchased were enough to ensure that everybody in our population was vaccinated. And I'm deeply proud of not just the government's work, but the work across the health system to make sure.
Thank you. That's 40 seconds. Thank you. How many vaccines were purchased?
That's your time. Dr. Hanley, please, for 5 minutes.
Thank you, Mr. Chair. And I'd like to add my welcome, Minister Holland, to you and to all the officials here at committee, most of whom I can't even see. So, Minister, as you mentioned in your opening comments, you were recently in British Columbia to announce a first agreement as part of the bilateral agreements that were outlined back in February. And I'm certainly looking forward to progress on the bilateral agreement around the country, particularly with the Yukon. as I know you are too. In this committee, as you know, we studied, and as Mr. Pawlowski referred to, we did study the healthcare workforce crisis with many important recommendations coming out of that study. And completely related to that dire shortage of healthcare professionals is the lack of access to a family doctor or primary care team professionals. Too many Canadians don't have access to primary care. I've met several times either with local professionals and organizations in my own territory, but also in important national organizations like CNA and CMA. They recommend many measures such as supporting mental health and retention initiatives, encouraging targets, clear measurable targets in the words of CMA that enhance patient access, improve working conditions, modernizing health systems. And you touched on many of those aspects actually in your remarks. So I'd like you to comment on how some of these goals, particularly in how we work with provinces and territories on measurable outcomes that include relief for our most valuable healthcare professionals, but also rapidly help Canadians get access to primary health care, all within about a minute, if you can.
Well, I'll say, look, it's essential that every Canadian have a relationship with a family doctor. And access to family health teams is absolutely critical. And you talk about, and I do look forward to being there in Yukon and announcing the bilateral agreement and the Aging with Dignity agreement for Yukon. It is essential, and really you see it in the BC agreement, to provide support and to work collaboratively to make that happen. And the BC agreement also had really critical pieces to help First Nations communities at a community level and really build community resilience. I think one of the advantages of these bilateral agreements is that they look at the problems that are unique and specific to every province and every territory and help work with them to give them the flexibility to create the solutions that they need within their jurisdictions to meet these challenges.
Thank you very much. One of the other areas in the mandate letter is about promoting healthy eating through advancing a healthy eating strategy. I recently met with officials, including Dr. Warshawski, who you may know from the from BC, from Kelowna, but is involved with the Stop Marketing to Children's initiative, and where certainly there are concerns over how we're doing with the draft regulations. And I wonder if you can maybe elaborate on where we are in the regulations for stop marketing to kids and what aspects we need to get to make sure that that's really a robust strategy when it comes to fruition.
Well, thank you for that question, and you're absolutely right. I mean, we've got to look down the stream. In order to really transform our health system, it isn't just about the changes that we can make today, but it's about making sure that we stop folks from getting sick generally. I'm deeply concerned that childhood nutrition and challenges with childhood nutrition are literally leading to a tsunami of chronic disease and illness, that we're seeing diabetes in children. And we have to turn that around. I'm deeply concerned that the advertising that is targeting children and leading them to have not only nutritionally vacant products, but products tied to marketing that are injurious to their health. And that's why our colleague, Patricia Latanzio, I want to commend her PMB. It was something that I advocated for in my time at Heart and Stroke. It's now working its way through the Senate. We want to see the regulations be in place by spring of 2024. And I also just would take a minute to talk about front of pack labeling and how important that is. That's going to come into force in 2026, and that there's still a lot more work to do. But the Canada's Food Guide was another major milestone in our action on nutrition. And we need to really be focused on that space. We don't talk enough about nutrition. We talk about physical activity. But if we're really going to transform people's health and avoid the worst outcomes, healthy eating is critical. 70% of chronic disease and illness, whether it's heart disease or it's cancer or you name it, stroke, about 70% is preventable. Right? We can stop people from ever getting sick in the first place. So we have to be up that stream. Not only is that a matter of saving lives, that is going to realize exceptional cost savings. So when we talk and see the cuts the Conservatives are talking about in preventative medicine, that's what the realization is going to be. More cost, more sickness, more problems. We can't allow that to happen.
Thank you, Minister.
Thank you.
Thank you, Dr. Hanley. Monsieur Thériault, 2 minutes et demi.
Mr. Minister, have you already seen a federal government be defeated on health issues during an election? Recently, there was an election in Manitoba, and it was an election on a federal election. No? The answer is no. Okay. In Quebec, I've seen several since the 1980s. Because the level of accountability is not the same. Do you want this accountability that the provincial premiers have with regards to health care and providing care? Because in an election in Quebec, health care is it's a ballot question. So I'll tell you why. You're saying that we don't need a public inquiry, an independent public inquiry. Well, that is your accountability, what happened during the pandemic, and you say, oh, no, we're going to solve it. Well, it's possible that you could be defeated if there were issues during the pandemic. If you don't need a COVID inquiry, well, can you answer this question? Why was the reserve of PPE empty? Why did we have old stock? Why did we send PPE to China shortly before Quebec declared a health emergency? Well, for me, the objective is to create a spirit of cooperation and to find ways for us to work together, more specifically on specific issues. It's essential to share information between provinces, and also it's important for the federal government to provide funding and to make sure that we respect the Canada Health Act, that we protect our public healthcare system. The responsibility does exist, and that's a good point. Eventually, it's possible that an election will be decided on healthcare issues federally. So what you're saying is that when a province will have a bad performance, you're going to take the accountability of this and will be able to tell you your plan was bad and you accepted that this province is not corresponding to decisions or standards and conditions that were imposed because we were inefficient in the mastery of these conditions. Is that what you're saying today? But constitutionally speaking, we don't have the same level of accountability federally and provincially. No, that's not what I'm saying. Not at all. That's not what I'm saying. Data is not for myself. It's not for the federal government. The data is for Quebecers. Not necessarily. The data is for Canadians throughout the country. And that way people will be able to measure progress in their healthcare system. It's essential. It's essential. If a government is providing funding, it's important to see the improvements in the system. In Quebec, that is solved in an election. During an election, that's where it's
Mr. Davies, please, 2.5 minutes.
Thank you, Mr. Chair. Minister, Canada's patented drug price regulator, the PMPRB, recently announced plans to relaunch consultations on long-delayed reforms. I think they started in 2016, meant to save Canadians billions of dollars on the cost of medications. As I'm sure you're aware, last year these reforms were derailed by your predecessor, Minister Duclos, who was accused of undermining the arm's-length agency's independence by asking it to suspend the reforms at the request of Big Pharma, was the accusation. This led to a series of high-profile resignations at the regulator. Can you confirm, Minister, when these reforms will finally come into full effect?
Well, I think, as you've acknowledged, and I think is very important, there's an arm's length relationship that is present. We've made sure that the board is populated. It has an incredibly important mandate. I look forward to working with them in that arm's length way to take action in this space and welcome their advice and their cooperation as we work together.
Thank you. Back to the breast screening guidelines. In May 2023, before the expedited review of those guidelines had even started, Dr. Guylaine Thériault, a member of the Canadian Task Force, told the Toronto Star that she does not see any reason to change the guidelines. In addition, the Task Force Working Group has reportedly started to vote upon recommendations, even though the evidence review is incomplete. Can you assure us, Minister, that you will act to ensure that any bias in the task force on the breast screening guidelines is effectively removed so that Canadian women can get the best evidence available and the best breast screening guidelines that they can?
Well, I think it's fair to say, through you, Mr. Chair, that we are absolutely committed to making sure that the breast screening guidelines are as strong as possible and that they protect women across this country. I share your concern in this area and look forward to working with you to that objective.
Thank you. Quickly, I don't know if you've had a chance to review this, but it seems the gold standard is to recommend mammograms for women between 40 and 49. Is that something that you're prepared to move towards on a national basis?
You know, I think, again, I can commit to having a continued conversation and for us to continue to look at this. I think we share the top line objective. How we get to that can be a continued conversation.
Thank you, Minister.
Thank you, Mr. Davies. Colleagues, we've got about 5 minutes left in this hour, which is probably enough time to turn the witnesses around, but not enough time for 2 more rounds. Mr. Morris has indicated that he wants to ask a question, but he would require unanimous consent, and I know already that it isn't here. So what I'm inclined to do is to thank this panel and get the next one set up and start anew. So
we got 4 minutes left, and we can't do.
Do you want to do 2 each?
Sure.
Okay. 2 minutes for the Conservatives, 2 minutes for the Liberals. Mr. Doherty for 2 minutes.
No, Mr. Chair, I wouldn't agree to that. We just completed a full round, and were you to proceed with that, then it leaves the Bloc Québécois and the NDP without a question. So,
actually, Mr. Davies, we haven't completed a full round. A full round would be another 5 minutes for the Liberals and another 5 minutes for the Conservatives, but we don't have that much time, so they've agreed to cut their time. A full round would be a full 5-minute turn for each of them. So, Mr. Doherty for 2 minutes.
You indicated that you intend to have a national single-payer pharmacare program established by the end of the year. How much is this program going to cost Canadians?
No, what I've said is that taking action in the space of drugs. Well, I haven't, but you're saying something I haven't done.
Okay, so how much would that? Have you done the work to?
I couldn't say. It's not something I've committed to. It's not something I've said. So you're asking me something I haven't said or committed to.
Have you done any work? Has any work been done on the single payer?
By many different. The Hoskins report was done. There's many different projections of how much the cost would be.
And what would that cost be projected?
Again, I wouldn't hazard. There's many different numbers I've heard, and as I said, we have not done any work to verify those numbers.
Okay, so as you stand right now, there's no work that's been done other than there's no single payer user pharmacare coming in the coming months.
I haven't made a comment on it one direction or the other. You asked me what cost would be if we were to be in a situation where we were talking about something that we're bringing forward.
In the 2021 election, you were elected. Your government was elected on the promise of a mental health transfer. What happened to that?
Well, Minister Sachs would be the best place. She will be here in about 4 minutes.
But as a Minister of Health, you can't comment on that?
Well, I think she's better placed to respond, and she's coming in 4 minutes.
Okay. Thank you.
Thank you, Mr. Doherty. And now over to the Liberals for 2 minutes. Ms. Sidhu.
Thank you, Mr. Chair. Thank you, Minister, and your team being with us. Minister, you were interrupted when you were wanted to talk about misinformation. When it comes to the baseless attack on Dr. Sharma, combating misinformation is relevant to the work you are doing for your mandate. I would like to allow you to finish your thoughts on that, or Dr. Sharma, whoever.
Yeah, thank you. Look, I was in opposition. I get it. You attack government, you cross swords. It is an important challenge function. I signed up to be a political actor. Tough questions of me are fair. But Dr. Sharma, who's been in health for 20 years, when you attack Canada's medical officer of health and try to claim that the things that she's saying aren't true, it's a deeply dangerous thing to do. And frankly,
Point of order, Chair. Point of order.
Point of order from Dr. Ellis.
Yeah, I guess the minister was not even here, and I guess the point would be that commenting on things of which he has no knowledge is well beyond the purview of his ability to make comments in this committee. And certainly we're talking about misinformation, and I think those of us who were here heard significant misinformation from Dr. Sharma.
That's an interesting point of debate, but not a point of order. Finish your answer, Minister.
Look, the point is that we can't afford to cross swords on health information. It is critically important that Canadians trust the health information that they're given, and that we don't play games and don't cross swords on it. And it is totally fair game to attack me in any which way works for you on Reddit or whatever Twitter source you're trying to work. But to attack officials
We have a point of order from
is
Mr.
something that I
Doherty.
had not seen in my time in opposition,
Minister.
and it's something that I don't think is
Minister,
at all
please.
appropriate.
Mr. Doherty on a point of order.
Point of order, Mr. Chair. At no time was there an attack. Mr. Chair, all what was asked is for Dr. Sharma to clarify or qualify her testimony, because there was proof that her comments were wrong. I asked repeatedly for Dr. Sharma
Okay,
to
Mr.
qualify
Point
that
of
answer.
order.
Mr. Doherty, wanting the floor to contradict something that was said does not amount to a point of order. Everyone here knows that. Go ahead, Minister.
Misinformation during the pandemic cost, I don't know how many lives. It caused all kinds of people to be hesitant to get a vaccine that could have protected them. I'm just asking for us to be very careful. If we're going to make decisions to try to attack each other, that's a choice that can be made. But the people who have worked under successive governments, liberal and conservative, to do their best to protect the health of Canadians and to accurately reflect on a basis of science and data information is something that I would just ask folks treat very carefully.
Thank you, Minister, and thank you to the team of officials that have been here to support you. It has been an eventful hour. I thank you for the way you've handled it, and we look forward to having you back before the committee before too long. So with that, I'm gonna suspend for about 3 minutes to allow for a change over to the second panel. The meeting stands suspended. Some of them you will recognize who have been here from the outset, but I believe we have a few additional ones. Eric Costin, Associate Deputy Minister, Michelle Boudreau, Associate Assistant Deputy Minister, Strategic Policy Branch, Jennifer Sachs, Associate Assistant Deputy Minister, Controlled Substances and Cannabis Branch, and from the Public Health Agency of Canada, Nancy Hamzawi, Executive Vice President. Minister, I think this is the first time that you've come before the committee. I just want to let you know that the way we operate, especially when ministers are here, it seems to be much more relevant, is that you are allowed to provide an answer that's equal in length to the question that you were asked. If you go longer than that, you can expect to be interrupted. But if you're asked a 1-minute question and you're interrupted after 4 or 5 seconds, I will intervene to make sure that you get a chance to have the same amount of time. And encourage you to use the earbuds for translation if required. So with that, welcome to the committee. Minister Sachs, you have the floor for the next 5 minutes or less for your opening remarks.
Okay, well, thank you, Mr. Chair, and thank you, colleagues. It is really an honor to be joining you this evening to talk about a subject that I'm sure for everyone around this table is top of mind when it comes to mental health. Mr. Chair, as you know, Canada is facing one of the most serious public health crises in our country's history. And since my appointment, I've been listening to provinces and territories, Indigenous communities, researchers, health stakeholders, and people with lived and living experience to gain a deeper understanding of the issue and to chart a path forward. Every death due to this terrible crisis leaves someone behind. We all know a friend, a partner, a parent, a child, a coworker, or a neighbor. As minister, I've heard heartbreaking stories of addiction and loss, as have many of my colleagues who are here tonight. At the same time, I've also heard inspiring stories of support, of recovery, and of hope. People on the ground are working relentlessly to fight this crisis, and the federal government needs to be there to support them. Canadians must have access to a full range of services and tools to address substance use. Harm reduction as well as treatment and recovery are health care. Everyone's journey is different, and we know there's no one-size-fits-all recovery, and we can't help someone that is dead from an overdose. I know some members, and I may not always agree on everything, but I am absolutely convinced, Mr. Chair, that everyone at this table shares the objective of wanting to save lives. This week, we launched the renewed Canadian Drugs and Substances Strategy. The CDSS presents a whole-of-government approach to address substance use, and the expert task force called for bold actions, significant policy change, and we are delivering on this each and every day. I'd also like to point out, I know my colleague Minister Holland mentioned this, that the Government of Canada's $2 billion historic investment in healthcare, which was announced this year. Mental health and substance use is one of the 4 shared priorities and will be embedded in the 3 others. Because, Mr. Chair, we can't have health without mental health. In addition, we continue to support community projects that address these issues. And in fact, we recently launched the 2023 National Call for Proposals for the Substance Use and Addictions Program to help address substance use harms and improve health outcomes for Canadians. But as we all know, the past few years have been extremely difficult for most Canadians, and we can't look away from that fact. The COVID-19 pandemic affected individuals and families across the country, and we are still living through an exceptionally difficult time with many people who are experiencing stresses related to war, geopolitical unrest, climate change, not to mention the financial worries. Mental health is now a topic of conversation in almost every home in this country. It's now easier to share that it's okay to not be okay, but there are many challenges ahead. We need to do better in order to completely create accessible care, remove barriers to care and services, and including reducing the stigma that is still prevalent amongst our communities. Negative and often unfair beliefs related to mental illness and substance use are one of the many obstacles being faced by people looking for support and can prevent some people from even asking for the help they need. Marginalized groups often experience more stigma or prejudice, putting them at an increased risk of harms. This includes our youth, Indigenous peoples, racialized communities, and the 2S LGBTQ plus individuals who are part of our communities as well. But this is why we are committed to increasing access to the full continuum of mental health and substance use services through a compassionate lens and a human-centered approach. Later this month, the Centre for Addiction and Mental Health, CAMH, will begin operating the 988 line, Canada's 3-digit number for suicide prevention and emotional distress support. This number will make it easier for people to access the help they need when they need it the most. Mr. Chair, together we can save lives, but we do need to learn from each other to ensure that there is a comprehensive, evidence-based, and I will use this word a lot, compassionate approach. Together we can create real systemic change and give every person in Canada the support they need to live a long and healthy life. I look forward to your questions.
Thank you, Minister Sachs. We're going to go now to rounds of questions, beginning with the Conservatives. Mr. Doherty, please, for 6 minutes.
Minister, a personal question first. I know you've got family in the conflict. How are you doing?
Thank you for that question. That's very kind. I think, like many communities across the country who have loved ones in the region, it's a challenging time of worry and anxiety, but thank you for asking. That's very
Appreciate
kind.
that. Hopefully you'll be kind to me, Chair.
You're off to a great start.
Well, we'll take the gloves off now. Minister, is safe supply working?
And can you clarify what you mean by working?
Is it saving lives? Is it not causing more overdoses?
Well,
it's a simple answer. In your opinion, is it working?
In my opinion, Safer Supply is one of the many resources and tools that we're using in a comprehensive approach towards substance use.
Can you tell me the latest number of deaths attributed to the opioid crisis this year?
The latest number, I know that it's on average 21 deaths a day, which is far too many.
That's correct. Do you have an estimated total number of deaths from 2016 to the present?
I don't have it in front of me.
It's about 38,514.
Yes.
Do you believe those numbers are accurate, or do you think that those stats could actually be higher? Because we know the stigma attached to it.
Well, I do know that those stats are coming from a number of sources, including coroner's reports, and I think that every death from an overdose death is a tragedy.
I agree with you on that. Can you tell us which provinces have the highest death rates?
As is well known, BC has the highest death rates in the country. Yukon as well is struggling, and I would also add that within Ontario, both Thunder Bay and Timmins are reaching above average numbers in overdose deaths.
The majority of the deaths occurred in BC, Alberta, and Ontario. Can you tell us the demographic that's been most affected by that epidemic?
According to the data that we have currently, it's Indigenous peoples.
It's young to middle-aged males, 73% this year.
So,
in terms of research, do you know how many of the deaths were fentanyl-related? A percentage is what I'm looking for.
I'll turn to one of my officials for the statistic
You don't know
numbers.
you don't know those numbers?
I look at the overall picture of the number of deaths. I don't have in front of me the data of the breakdown by drug, but I'm sure the officials can offer you an answer if you'd like.
About 81%.
Yeah. Okay, thank you.
Minister, did you have a chance to read Adam Zivo's column and stories in the National Post recently about diversion?
I'm aware of the articles by Adam Zivo that are anecdotal.
It's absolutely staggering. Users go to Reddit and they buy the pills that our government gives out for free. Adam put together a spreadsheet with over 50 posts diverted to Safe Supply. It is staggering. I will actually share it with you on privately offline, Minister, because I think that you'll be staggered by that. Are you familiar with your government's 2016 shift from an anti-drug strategy to a harm reduction strategy?
Yes, I am. It's part of 4 pillars of our overall drug strategy, which includes prevention, harm reduction, treatment, and enforcement, looking at this as a health crisis and also understanding that there's an important lens of public safety involved.
So you've doubled funding every year to this opioid-related health emergencies in BC and Alberta. In 2023, you proposed the largest annual opioid crisis expenditure to date, $359 million. This strategy isn't working. We've got leading addictions medical experts that are writing letters to you. They're imploring you to actually reevaluate this.
May I answer the question now, Chair? So I'm familiar with the letter of the 17 doctors who are part of who are involved in our substance use addictions programs and offer prescription treatment. However, what I will say, they are experts, like there are many experts, and anyone, in my opinion.
Do you discount their?
No, I don't discount anyone who is committed to helping those who struggle substance use and are willing to save lives.
Minister, you recently signed health accords. Your recently signed health accords includes shared health indicators and results intended to measure progress in the 25 billion sent to provinces. As you know, mental health services are covered under Medicare only if they're delivered by doctors in hospitals. Most other services are delivered by charities and community nonprofit organizations are not systematically captured in the health reporting. Can you please elaborate on how the government intends to accurately collect the data on the indicator that measures the median wait times for community mental health and substance use services?
Well, first and foremost, the way we are looking at the data collection at this time is to have a comprehensive lens of need.
So how will the government then hold the provinces and territories accountable for funding to community mental health when the health accord itself does not direct funding explicitly to community mental health services?
The bilateral agreements include detailed work plans of the allocation of efforts and work that will be done.
Do they specifically direct the funds to community mental health programs?
As the member well knows, that provincial jurisdiction is, healthcare falls under provincial jurisdiction, and we have key principles in place that are allowing for this, but also we work with CIHI, so ensuring that the research and the individualness data are fed into the system so we can see how it's working and monitor and evaluate.
What happened to the mental health transfer that your government promised during the 21 election?
So in 2017, we made a commitment of $5 billion, which is still ongoing, to have mental health supports. But what we learned...
That's all the time for questions, Mr. Doherty. Go ahead and finish your answer, Minister.
What we learned through this process is that an integrated approach of mental health services as part of primary health care is the best way to serve Canadians in receiving mental health services.
It's just a front panel. Don't
Yeah, no. The hammer was brought down, but I didn't bring it. Minister, have you finished your answer before we were?
You.
Yeah. Okay. Thank you. Yes, I'm fine. Thanks for asking. Next, Ms. Sido for 6 minutes, please.
Thank you, Mr. Chair. Thank you, Mr. Sachs, and your team for being with us. My question is to Minister Sachs. Many of our youth are struggling with mental health. I understand there has been a significant success with an integrated youth services model of care. Can you tell us why this approach is so promising?
So I want to thank the member for the question. And what I will say is that what we do know, and particularly coming out of COVID, that our youth, the kids are not always all right. The isolation and what went on during the pandemic of being at home and being away from the social structures that really help enhance the growth and resiliency of our young people was cut off during that time period. But the federal government made a commitment to integrated youth services, which incorporates wraparound supports for youth and their families, which not only is primary health care, but the other aspects of care that come with it, whether it's vocational and job training, whether it's social environments, in some cases with Indigenous communities, land-based learning, with an understanding that we really want to invest in our youth to make sure that they have the best tools that they need, and also the preventative tools of education to understand the impacts of substance use so that they are well equipped to be out in the world and understanding what resources and services are available to them. We've made sure that these are by community, in community. And the best example I can give is the Foundry in BC, which has a wonderful set of services, as my colleague from BC here on the other side of the aisle would well know. And we know that these investments, the impacts are long-standing, which means that if we invest in our young people now, it is an upstream approach to better mental health care for them in the future. And we've seen good results, and the programs are expanding.
Thank you. My next question is bringing and giving birth. It's a joyful occasion. Unfortunately, we know that new parents may also be struggling. I know our message to them, please do not carry this burden alone or in silence. getting help is the most important thing you can do for yourself. How can you help these new parents, as perinatal mental health issues can have long-lasting impacts?
So I'll thank the member for the question. And I'll say, if I can just share personally as a mother to two teenage daughters, it was one of the most exciting time in my life to be pregnant with them, and also in many cases the most terrifying. And that is the case for many individuals who go through pregnancy and then birth, and many families. And that's why we understood that perinatal health, which follows a woman through the course of her pregnancy and afterwards, is a critical part of not just ensuring her mental health, but the best success for the child. We've taken on an approach working with the Public Health Agency of Canada to develop a national strategy of what are good interventions that medical communities can use in guiding their patients through the perinatal process to ensure that they have the best outcomes both for parents and for their children.
And I just want to know that how we are working with when there's a culturally sensitive mental health services, how we are providing that, there's a stigma out there. And can you elaborate that, especially on the culturally sensitive mental health when we are providing that?
Absolutely. And as I mentioned in my opening remarks, we have to make sure that mental health services are accessible for people when they need it, how they need it, and where they need it. And we're so fortunate in Canada to be a multicultural and diverse Canada. And also recognizing rural and remote communities, our Indigenous communities, Black communities, LGBTQ2SI. And in order to be seen and embark on the brave journey of getting mental health supports, you need to know that those who are serving you truly see you and understand you. And that's why culturally appropriate supports are really important. One of the programs that we're actually quite proud of is the funding support that we've provided Black Canadians through the Black Canadians Mental Health Program through the Public Health Agency of Canada. We just hosted a summit here last week on Indigenous wellness with Indigenous mental health care providers from throughout our First Nations communities. Just this past weekend, I was up in Markham for the South Asian Health Alliance to understand the important need and advocacy within our South Asian communities throughout this country when it comes to their mental health and health care. And that's something I think we can be proud of as Canadians, that we really make sure that the diversity and equity lens is in all the health services that we provide, including mental health services.
Just want to ask about the virtual care. It has been an important tool to mitigate the additional strain in the pandemic. Can you elaborate on virtual care, how it is important for mental health?
Absolutely, and I want to thank the member for her question. So, during the pandemic, the federal government made a bold move, understanding that Canadians were struggling with their own mental health, and opened the Wellness Together portal, which not only included online services of self-tools and resources for assessment, but also online services for counseling and other important evidence-based and comprehensive tools for mental health. And we know that it was a lifeline for many. Just today, I was part of the FRAME Forum, which is a youth mental health network that works specifically in the digital space. Going back to your question about youth, youth are accessing their information, but also their health care through digital platforms, and we have to make sure those spaces are safe, evidence-based, and again, meet our young people where they are. So I think virtual care is a key component in how we are forward-thinking in how we deliver healthcare services and mental health services, but it also means that we can service rural and remote communities who wouldn't necessarily have the opportunity for in-person clinicians.
Thank you, Minister. Thank you, Ms. Sidhu. Suite, M. Thériault, pour 6 minutes, s'il vous plaît.
Merci.
Thank you. Hello, Madam Minister. Let's try to have a 6-minute conversation. Do you know, what is the first authority in the world to have elaborated a mental health plan?
Monsieur le Président.
Mr. Chair? Go ahead.
Elaborate a mental health plan? Is that your question?
Quelle est la première?
What is the first authority in the world to have elaborated a mental health plan?
I'm afraid I don't know.
C'est le Québec. C'est le Québec en
It's Quebec in 1989. And I would like to say that with all due respect, Quebec did not wait for the creation of a ministry responsible for mental health to do the work. Do you know the interdepartmental action plan for mental health in Quebec? Are you aware of this?
I did recently meet with my counterpart, Mr. Carmont, on the Quebec plans, and we discussed a comprehensive approach to mental health services that include the social determinants of health and their considerations of helping those particularly with substance use.
Oui.
Yes. It's a good plan. You would qualify this plan as being a very good plan, I imagine, because it's interdepartmental. So we don't work in silos, and we can agree that mental health is a good. This is a good plan. It goes up to 2026, and it's interdepartmental.
Two things. One, having previously been the parliamentary secretary to Family, Children, and Social Development, and having worked on the national child care system for Canada, we look to Quebec for our best lessons learned after 25 years of ensuring that there was high-quality, affordable childcare. So I'm not surprised that Quebec is forward-thinking in the model and plan that it's put forward. And as a matter of fact,
C'est un bon plan.
So it's a good plan. It's an excellent plan. Yes or no?
I think that an integrated approach to health care and government plans are important.
Mais alors, le Québec.
So Quebec will invest $1 billion, over $1 billion, to implement this plan. And there are 43 different measures in 7 pillars of development within the plan. So we agree that it's a good plan. In the unanimous motion that was passed at the National Assembly, Quebec is telling the Government of Canada, the federal government, that it would be entitled to unconditional funding. So why is there not already an agreement and funding coming to the government in this $25 billion that was set aside for bilateral agreements? And also, why wouldn't Quebec have a right for mental health, because it's a world leader in this, to have its money and be able to manage its own affairs, because they are leaders and have made a lot of headway, and it's money that is missing for years now.
Member well knows there are ongoing discussions with each province and territory. Health is under their jurisdictions. I agree that an integrated approach to health is an important lens to have, in each province and territory determines how best they want to see that integrated approach. I know that Minister Holland continues his conversations with the Minister of Health of Quebec to ensure that the proposal and agreement that Quebec will have is the one that they want and that works with the federal government's commitments.
Mais quelle est votre intention?
Yes, but what's your true intention with regards to mental health? What is your expertise in mental health? In order to tell Quebec that we know better than you what you should do. But we've just agreed that the plan that goes to 2026, there's already a money that's been put into this, and they need more. Why not just send the money and make sure that Quebec's able to manage this?
Well, as the member would know, in the previous rounds of funding of SUOP, for example, Quebec was given its per capita sums to determine how best to utilize the funds within its province. We admire the work that Quebec is doing, and like every other province, it is their jurisdictional purview to ensure that they are prioritizing the health of their residents in their province, and we work collectively, positively, and with shared principles which were mapped out and which include mental health not only as a priority, but also embedded in the other 4 priorities of the principles set out in February, of which Quebec was a part of.
Oui, mais j'ai comme pas l'impression.
Yes, but I don't have the impression that you're really answering my question. Would you agree with the fact that Quebec, as a leader, they have an excellent plan, and you said so, for mental health, but Quebec needs additional resources and funding from mental health, that they be able to receive the money that they are due, and that Quebec be able to manage these programs as quickly as possible. And what do you think about that? Why not? Why is there no agreement, and why hasn't the money already been sent? I feel like a double structure is being created. Don't you think that for mental health, money has to be spent out in the field? When you look at the action plan, it's that. Why are you creating a parallel structure? At the federal government, they're going to be stuck in national strategies. We're going to need a national strategy to manage the national strategy.
From what was committed to in February, as the member well knows, 131. Is it 131.8 billion? That is total. What I will say to the member is that each province and territory has an allocated amount as part of the bilateral agreements. It is not for the federal government to impose its position on how the province of Quebec would like to utilize its mental health funding. We applaud the efforts and the work that the Quebec government is doing to ensure that Quebecers have high quality mental health. And like in many things in Quebec, they are wonderful models for other parts of the country.
Thank you, Minister. Merci, Mr. Thériault. Next, Mr. Johns, please, for 6 minutes.
Well, first, I want to thank all of your staff and team for being here and the hard work they do, and congratulate you again, Minister, on your new appointment. Now, Minister, I'm wondering, you've got a new mandate, or do you have the old mandate? Because I haven't seen a mandate letter come out for you. And are you basing your mandate on the 2021 mandate letter?
At this time, I am continuing with the mandate letter that was provided to my predecessor.
Okay, in the mandate letter, there was a commitment for $4.5 billion over 5 years, straight up for mental health transfer. We are post-COVID. A lot of people are still suffering. In fact, more people are suffering than pre-COVID. I'd say we did an okay job helping people get through COVID, but right now, COVID recovery really needs to come in the form of mental health and a response to that. Are you going to push for the $4.5 billion promise? $1.5 billion was supposed to be spent by now. Are you committed to that, or is it a broken promise? Because this is on top of the 2017 commitment and the bilaterals.
So I'll thank the member for his question and do appreciate his strong advocacy in this area. What I will say, as you mentioned, the 2017 commitment is still ongoing and those funds are still being distributed, and we've made that commitment and that funding will be there. But in our work with provinces and territories, and this is the conclusion we came to in February in our collective discussions with our counterparts, was that the best way to provide mental health care for our communities is part of an integrated care approach. And that is what we are doing.
Well, it's cryptic. The transfers, it's cryptic. It's going into 4 priority areas. We don't know how much is going. The $4.5 billion was actually promised on top of the 2017 amount. I'm calling on you urgently to roll out a $4.5 billion mental health transfer as a COVID recovery response measure. In terms of the toxic drug crisis, you've got a renewed Canadian drugs and substance use strategy. I'm glad to see it's integrated, coordinated, and a compassionate model. But now compassionate means action. Where is the timeline and a plan to respond to this crisis with resources and targets?
So I'll thank the member for the question. So the launch of the CDSS was on Monday, and one of the key things that we anchored in this renewal of the CDSS was to look at this from a very integrated approach, meaning there are 15 departments that will be involved in rolling out the strategy going forward. We are in the process of putting the consultations together to ensure that we do have cross-pollination of policy and successful outcomes in the rollout. And so at this point in time, we don't have a specific timeline, but there are ongoing work that is still going on. We also announced on Monday 52 projects under SUOP that will be continuing that work.
Minister, there's 40,000 people almost that have died since your government came to power in 2016. You've spent about less than 1% in terms of responding to the toxic drug crisis that you spent on the response to COVID-19. That is purely the stigma that's attached to what's going on. And I want to know when your government's going to prioritize this issue and make it an urgent response. Why has the Prime Minister not held a First Minister's meeting with all of the premiers, giving that in my home province, it's the leading cause of death for people the aged under 59 and under?
So I'll thank the member for the question. And you're right, we've spent about $1 billion to date on the overdose crisis, and we continue to make commitments towards it. But I would say that to the number of deaths that you are referring to, I would also say that we've overturned nearly 50,000 overdoses during that time. We've had 4.1 million individuals visit safe consumption sites. We've distributed over 1.5 million naloxone kits, which also go to saving lives. So to insinuate that the government has done nothing would, I don't really see that.
I didn't say nothing. I'm saying this, that in a health crisis, incrementalism costs lives. We demonstrated the urgent way we can respond and overcome barriers. We broke down barriers in all levels of government to respond to COVID-19. We need to do that here. You know, I went to Portugal this summer and I learned from the Portuguese about what an integrated, compassionate, and coordinated model looks like. But I also learned what a health-based emergency looks like. They rolled that out. They had 250 people on methadone. They scaled that up to 35,000. The Army came in and built labs and produced it at cost. They built 96 therapeutic treatment centers to create just-in-time treatment. When is your government going to respond like the health emergency that it is? Because Portugal had 100,000 chronic problematic drug users. We have 100,000 in BC, and we're half the population alone. When is your response and your government going to react like other countries around the world?
I'll thank the member for the question, and I would say we are responding. We have ongoing programs that are in place, but I would also say this. We recently met with our counterparts in Charlottetown, and province by province, we wouldn't necessarily always agree on the treatment programs, prevention, and harm reduction plans. Each province has its lens in healthcare of what it would want to do, but there was a strong commitment with my counterparts around the table to ensure that we are working together, and have actually agreed to meeting quarterly now because we understand the urgency. But this will take an all-level of government approach. It is not for the federal government to solely dictate how we intervene in this, because there's no one silver bullet, and we won't be able to overcome the toxic drug supply or the overdose crisis in a split second. It will take time, it will take planning, and it will take commitment from all levels of government to do it.
What's impressive for me is that we found a way to break down barriers within hours during COVID-19. But we are 8 years in. And what I'm looking to you, Minister, is to break down those barriers and demonstrate a real sense of urgency. I mean, there's things that we all agree on around this table. Let's advance them. Are you willing to do that? Are you willing to bring the premiers together, work with the Prime Minister, and come up with an urgent response to this crisis? Actually, urgent.
Okay.
As I said, the first step towards
that's
that.
the last question.
Okay.
Just brief answer, please, and then
So,
we're going to move
as
on.
I
Thanks.
said, I have asked my counterparts, and they've responded to have us meet on a quarterly basis to begin to address that urgency.
Thank you, Minister. Thank you, Mr. Johns. Next, Mr. Majumdar, please, for 5 minutes.
Thank you, Minister. It's good to see you. I'm curious, are you aware what year drug policy was moved from from justice to health?
I don't have that history, but I'm happy to ask officials.
2016. Can I ask, are you going to allow medical assistance in dying for addictions?
Well, medical assistance in dying in terms of mental illness is the sole. Could he clarify what he means by that, please?
Are you going to permit MAID for addictions as a prescription, as an option?
As the member well knows, the guardrails around MAID are for individuals who have a condition that is irremediable and terminal and has not been answerable to any other forms of treatment.
Do you believe addictions qualify in that realm?
I believe that each individual who has a substance use health issue has a different path and a different series of complex needs that need to be assessed. And there are experts who are far more qualified to determine what
Well, you're the minister responsible for setting policy for this. Can I ask how many deaths happened because of the opioid crisis in the first quarter of last year?
I'll ask my officials to answer that question in terms of statistics. Eric?
It's okay.
Yeah.
How many, when this entire file became moved to health in 2016, what were the total number of deaths by the opioid crisis?
answer, Stephen.
Okay. Well, the total numbers since 2016 to March 2023 is approximately 36,000.
That's not the question I asked. I appreciate your response. I'm asking the minister. Does she know how many deaths had happened? I think the answer is no. How about how many deaths occurred in the last year?
The number of total apparent opioid toxicity deaths in 2022, which is what we have the last total numbers for on an annual basis, was 7,483.
So we started
with an
at
average of 21 a day.
We started at 2,800 in 2016 when this government, the NDP Liberals, moved policy from justice to health, and now have nearly 8,000, over 8,000 in the last year. Are you aware what impact the safe supply policy has had on the informal market for opioids?
I know that there are articles of anecdotal evidence, anecdotal discussions on what is out there in terms of safer supply, but safer supply as it is currently distributed is under a prescription model.
95% reduction in prices because of how the government drugs have flooded the black markets. You know, in Leslieville, your taxpayer-funded safe injection sites are offering up chocolate bars to kids for used needles. And your
Mr.
government
Chair, point of
announced
order.
$4.6 million.
Point of order from Mr. Fisher.
Thank you. I'm very well aware that the Conservatives don't let facts get in the way of a good social media clip, but I would ask that the member please show respect to the minister.
Go ahead, Mr. Majumdar. That's,
What was that?
I'll respond to that another time because I have nothing but the highest respect for the minister. I'm just trying to get a sense if she knows her files. Your government has earmarked another $4.6 million for streamlining authorizations for supervised consumption sites. How many more Leslievilles do you plan on building across Canada?
It's based on an application basis to Health Canada for safe consumption sites to be implemented. They have to meet a stringent set of guidelines and evaluations before opening. They also have to be able to show, in addition to federal funding, that they are able to continue.
There's an ambition to open up more of these safe injection sites.
We believe that harm reduction is a key component in our policy strategy
Harm
to address
to
substance
Canadians.
use and the opioid crisis.
Minister, if harm to Canadians has gone up to such an exponential, out-of-control crisis, where the government is providing safe supply to a black market that is reducing price and making these drugs more accessible to children, that there are going to be more of these sites near schools across Canada. How can you, not knowing all the facts, how can you even sit at the table and support this unsafe supply legislation, this culture of death with MAID, if you don't know the scale of the crisis?
So I would first say to the member that he is throwing a lot of different pieces into the pot rather than looking at the drug strategy and policy that we put forward. The four key principles that we have in attacking and addressing the toxic drug supply in this country, as well as the overdose crisis, incorporates prevention, harm reduction, treatment, and enforcement, which means that we both have a public safety lens and a public health lens. Diversion is illegal and continues to be illegal, whether it is for prescription drugs. Chair, I'd like to be able to finish my answer.
Please finish it quickly. We're out of time.
Okay. Diversion is illegal and continues to be illegal and enforced. Thank you.
Thank you, Minister. Next, we're going to go to Mr. Johari, please, for 5 minutes.
Thank you, Mr. Chair. I'll be sharing my time with MP Morris. Minister, welcome to our committee, and it's good to see you in this profile and portfolio. Minister, you talked about the launch of 988 in your opening remarks. As you know, we are almost a month away from the launch. And first of all, congratulations. And can you talk about some of the work that's been done to ensure that we are ready for this launch?
I want to thank the member for his question, and I'd also like to thank Member Doherty for his work on getting us to the 988s, because these are the things that we can work on. Like I said in my opening remarks, there is a collective desire in this table to help those who are struggling with mental health, and this is when good work gets done across the floor, and I'm very proud of that. As you well know, 988 was embarked upon with the motion 2 years ago. It takes time to build out a national network. We had the United States to look at, which took 4 years actually for them to roll out their national 3-digit number. And we had a lot of lessons that we learned from them in going forward. We are now working with CAMH to make sure that everyone that sufficient organizations are hooked up into the system across the country. And it won't be only by calling, it will be both call and text in both official languages. And so far, provinces and territories are gearing up, and funding has also gone out to make sure that organizations are well supported with the launch.
Thank you. So I'll ask a very short question, follow up on that. So in your assessment, aside from the technology side and the network side, and aside from the strong partnership that's been with the organization, do you feel we are ready to be able to support those who need, especially the youth who need help coming November 30th, sorry.
I would say, one, the work of PHAC on this has been tremendous. We have Nancy Hamzawi here and Heather Jeffrey, who have been in close contact with my office on the progress that's been made. And not only are we ready, we have to be ready because our youth need us to be ready.
Mr. Morris, this is the moment you've been waiting for. 2.5 minutes.
Thank you, Chair, and thank you, Mr. Jawhari. Minister, I really appreciate you framing the poison drug crisis of one of public health. In my community alone, this year to date, we've lost 74 community members to poison drugs. Each one is a preventable death, as you know. My concern is that the recommendations from Health Canada's expert task force from 2021 on substance use, like ending criminal penalties related to simple possession and expungement of criminal records from previous offenses related to simple possession, of course, haven't been acted on. In fact, they were in Mr. John's Bill C-216, so they were actively voted down by our Parliament. And so deaths go up, and it allows others to then demonize programs that do work, like Safe Supply, for example. And so I'm wondering if this has you at all reconsidering the governing party's position on what was already recommended in the expert task force from 2021.
So thank you for the question. And what I will say is this, is that stigma continues to be one of the biggest barriers for individuals who are struggling with substance use and getting help. And when they are not able to, because of stigma, feel that they can't go for help or support, whether it's safe consumption sites, which saves lives. As a matter of fact, 50,000 overdoses were overturned. 4.1 million individuals who are able to use safe consumption sites are here with us today and able to manage their substance use or seek treatment. But what I will say is this, is that we have to take this step by step. This is an all-of-government approach, meaning that we both need provinces and municipalities to be on board in the steps that we take. BC made a bold move in their decrim and they asked the federal government for their pilot. And we are continuing to evaluate and monitor that to understand what works and what makes sense. I understand you in terms of the urgency. But we also want to make sure that we're moving with an evidence-based approach that really looks at a comprehensive set of tools.
Thank you, Minister. Thank you, Mr. Morris. Suite Monsieur Thériault pour 2 minutes et demie.
Mr. Thériault, 2.5 minutes. Thank you, Mr. Chair, 2.5 minutes. Well, you know, I have a specific interest. I sit on this special joint committee on MAID, and it was struck recently. The committee, in the first phase on mental health issues, did not believe that a recommendation should be made to the House on this subject. We looked at the experts' report. I imagine that you have also read the experts' report on mental health issues and put in place some benchmarks, and some are not present for MAID. What you have to tell us this evening, quickly, perhaps in a preliminary fashion, you might be invited again to the committee, but what could you say on how you are preparing the field. The committee wants to see how this is being prepared for mental health. Do you have anything to say this evening on that?
Chair, how much time do I have to answer the question, just so?
A minute and a half.
Okay, well, thank you. I'd like to clarify first, and perhaps c'est un problème avec la traduction, but what I'm hearing is mental health and not mental illness. And we're talking about mental illness as the sole determinant in terms of MAID, first and foremost.
Troubles mentaux, j'ai pas dit santé mentale.
I didn't say mental health. It was a translation mistake. I'm talking about mental illness. Yes, I know what I'm talking about. Yes, it was a translation issue.
Merci. So, at this point in time, what we know is that extensive work was done from the recommendations previously to provide regulatory bodies across the country with strong assessment tools, preparation of over 300 medical practitioners so far, and a set of guardrails that will ensure that when evaluations are being done with mental illness as the sole determinant, sole request for MAID, that practitioners feel that they are well equipped to understand what is going on. What we did hear, though, and which is why the committee has been struck, is that there needs to be a deeper understanding of those preparatory measures that were put into place to ensure that there is a comfort level in moving forward. But I would also add that I think this is a very personal issue. I think that for many individuals around the country and for many Canadians, it is difficult to understand and comprehend that it is one's right with their health practitioner to have these very important discussions on the choices that they make.
Thank you, Minister. Merci, Mr. Thériault. Next, Mr. Johns, please, for 2.5 minutes.
Yeah, Minister, the Substance Use Assistance Program has continually been oversubscribed. In 2021, there was applications and proposals up to $350 million, and the amount funded was $59 million. And there's still no funding allocated in the budget for SUAP beyond 2024-25. Can you provide a breakdown for how many proposals the government received in 2022 and 2023 for SUAP, as well as the total funding versus the total amount funded?
I can tell you the number of projects that we are funding by province
Would it be
and
something
territory,
that you could table to this committee and produce that to the committee?
I believe that officials can table that information for the committee, yes.
Minister, you can hear the urgency in my voice. I mean, I live in a community. Well, first, I went to Portugal. There was 6 deaths per million based on drug-related deaths. Canada's 180 from the poison drug supply. BC's 430. My island health is 503. In my community, under the age of 59, it's 2,100 deaths per million. This is from fentanyl, benzos. This is not from safer supply. This is from a street supply trank of mixed drugs. You had an expert task force. This government did, made up of police chiefs, social workers, experts, drug policy experts, people with living experience, Indigenous leaders. They made clear recommendations that you needed to stop criminalizing people who use substances, provide a safer supply to replace the street drugs, and to ensure that you invest heavily so we have just-in-time treatment, recovery, prevention, education. And you haven't done that. It hasn't done at the scale that's needed. I want us to get to 6. We can have hope that we can get to 6 deaths per million. Every death is too many. But when are you going to come up with a plan, and will you reinstate the expert task force so that they can give and guide your government on recommendations and hold you to account in making sure that you have a plan and timelines to implement it? Will you reinstate that task force to do that?
What I will say is at this time we have done a renewed launch of the CDSS to be able to enable us to not just look at what the experts have to offer in specifically to the toxic drug supply and those who use substances, but also the other social determinants that feed into to individuals who are struggling. I've seen some positive news. Yukon has declared a state of emergency and has provided a comprehensive plan of how they wish to go forward in addressing their toxic drug supply and overdose crisis. BC also has a plan that we've been working with them on. And as I said before, the urgency is there. We know the urgency is there, but we also need the provinces working with us on going forward with that. And I'm committed to working with every province and territory that comes to us and says we need help in getting a plan forward that makes sense for our province and our jurisdictions.
Thank you, Minister. Thank you, Mr. Johns, colleagues, we find ourselves in about the exact same position as we did on the last panel. We have about 4 to 5 minutes left. I'm going to suggest 2 minutes for the Conservatives and 2 minutes for the Liberals. And call on Dr. Ellis for 2 minutes, please.
Well, thank you very much, Chair, and thank you to the Minister for answering questions and being very well prepared this evening. I appreciate that. I had a very quick question around medical assistance in dying. We talked a little bit about mental disorders, the sole underlying medical condition. Many folks out there believe that that is simply around depression. Am I to be clear that you would support the frameworks that are now out there that substance abuse, those who suffer from substance abuse and choose MAID, that you would support that, Minister?
Just to clarify, anyone who is in a state of crisis, whether it's suicidal ideation or struggling with any kind of disorder in a crisis environment, would not be eligible for MAID.
I understand that, Minister, and certainly that becomes one of the problems, is distinguishing between suicidality and someone who wishes to end their life. My question is very specific, though. Under that provision, MAID for those with mental disorder or the sole underlying medical condition, would you support the framework that is out there now for those with addictions?
I think it will be the will of the committee to determine if the measures that we've put in place to assess with regulatory bodies is working, and if we need to do further evaluation on it at this time.
So
I guess be the will of the committee.
Maybe through you, Chair, maybe I could word it one more way differently. Would you oppose MAID for those with addictions?
I don't believe that someone with addictions has an irremediable health condition. I believe someone with addictions can be helped through harm reduction, treatment.
Well, thank you very much for that, Minister. But through you, Chair, then would those also with mental health not have a condition that could be helped? That would not be irremediable either, would it not?
The sole underlying condition is not a mental health condition. It's a mental illness condition as determined by the DSM-5.
I'm sorry, Minister, that your answers are really not making any sense, because, you know what, I was a family doctor for 26 years, and those with mental illness, they can be treated for their mental illness. So as you mentioned with substance abuse, you can as well. So which is it? Is it only diseases which the Liberal government chooses, or is it diseases which have potential treatment?
Okay, we're out of time, but take 15 seconds to answer that, and we'll move to the last questioner. Go ahead,
sure
Minister.
Dr. Ellis' clinician is very well versed in the DSM-5 and can answer that question himself.
Thank you, Minister.
So I'm going to answer my own questions at committee. I wait for the day. That'll be great, Minister. Terrific.
Next, Dr. Pawlowski, please, with the last round.
So
2
thanks
minutes.
to the Minister and for everybody else for appearing. We've heard accusations from the Conservatives, but I would say it has been supported by at least some healthcare professionals concerned about possible diversion of safe supply, so that some of those safe supply doses of Dilaudid are getting on the streets and ending up being sold there, and therefore augmenting the supply of narcotics on the street. Are you willing to consider the possibility that that occurs, and if so, taking appropriate actions to try to curb that from happening in the future?
Thank you for the question. As mentioned earlier by another member, there's anecdotal reports on Reddit and elsewhere with regards to that. But what I would say is when we look at a prescriber model of medications for those who are struggling with substance use, they've made the choice to go to a healthcare provider for a plan. And that, to me, shows signs of someone who is on the journey to recovery. Nevertheless, we are taking any allegations of diversion seriously, and which is why I've asked the department to begin to look into this in a deep dive way.
Well, I would suggest they could be seeking narcotics also to be able to sell it on the street. So that would be a possibility why they would go for a safe supply as well.
And as I've said, I've asked the department to take a deeper dive into this to ensure that that we have a safer supply program, but also that we are addressing the enforcement piece of diversion.
Thank you, Dr. Pawlowski. That concludes the time that we have with you. I know this is your first appearance before the committee, Minister, and it's greatly appreciated. You have obviously come prepared and answered all of our questions in a very challenging environment in a very patient manner, and that is greatly appreciated. And to all of your supporting cast for being here so late, thank you all. Is it the will of the committee to adjourn the meeting?
Yes.
We're adjourned.
Thank you.